Thank you, Tara. Good morning. I'd like to start by again thanking the millions of Washingtonians who are staying home and staying healthy. You are leading this effort as much as anyone, and the people are with this effort, and I am with the people. We know that. A new Elway poll released this morning showed that an overwhelming majority of Washingtons believe in this effort and understand that what we're doing is getting results. 76% of voters believe that the pandemic restrictions are actually working in our state. And the reason the people feel that is that they've seen the evidence. They've seen our mutual success. They've seen us bending the virus curve down as much or more than any other state in the country. And they've seen us saving lives. And ultimately, that's what this is about. That's why 61% are concerned about lifting restrictions too soon. And now, when I issued the Stay Home, Stay Healthy order last month, we knew the order was going to have significant impacts on people's lives, economically and otherwise. But we Washingtonians also knew that they were necessary and they were important to slow the spread of the virus. We knew that if it was unmitigated, it would have killed many more Washingtonians. And each one of those losses is not a number, it is not a statistic, it is a tragedy in our families. And we knew we could not allow our hospitals to be overrun and our economy eventually to be permanently devastated. We know that the Stay Home, Stay Healthy initiative is working, but we know that it has to continue to avoid a dire fate. And we know that much work remains to be done to control this virus. Now, we have been following a plan for reopening the economy since my first initial Stay Home, Stay Healthy order. And today, I'm glad to say that we have reached the first step of that plan. We have found a way to safely allow low-risk construction that is underway to resume. And we have been working toward this measure for some time. And this work has allowed us to create a very comprehensive safety plan because we are thinking of everyone involved in construction. And when I think of this, I think of the people who are hauling sheetrock up to the third floor. I think of the people digging ditches. And I think of the people who are out there in our beautiful Washington rain. And I would not support any plan that would not protect the people who are providing us our shelter. In early April, my office and key cabinet officials convened a stakeholders group with construction labor unions, contractor associations, and others to develop a plan that set high standards for when we were able to return to some of this work. And we now have recommendations for safe construction standards from this group that has been agreed to by workers and contractors and health and safety experts and local government officials who are involved in these discussions. So this process has got us where we know that hardworking people of good faith can reach good agreements as we rebuild our state. And their work, I believe, has served as a model of how to reach consensus and strict safety guidelines for other industries. I think it's going to be a good template as we move forward. Now, obviously, we cannot say when other businesses will reopen. We can't make decisions based on arbitrary dates. We need to make it on real data.
Jeff, we're having some trouble with your mic. Just one moment.
Thank you.
Sorry about that.
You mean people can hear me?
You need people to hear you. Yes.
No, the problem is they can hear me. That's
I think they should be able to hear you now.
How are we doing?
Good. Better. Good.
Okay. So what I'm saying is that obviously we cannot state unequivocally when other businesses could reopen because we can't make decisions based on arbitrary dates. We've got to make it on real data. So I want to reiterate that the day of reopening our whole economy certainly is not today. It would be way too dangerous, and all of our data shows that if we did this today, this virus would return with a vengeance. I'm pleased to be joined by 6 members of our Construction Roundtable Working Group. Greg Lane, Executive Vice President of the Building Industry Association of Washington. Mark Riker, Executive Secretary of the Washington State Building and Construction's Trade Council. Mike Ennis, Government Affairs Director of the Association of Washington Business. Josh Swanson, Government Relations at the International Union of Operating Engineers, Local 302. Dave DeHaan, Executive Vice President of the Associated General Contractors. And Matt Swanson, Political Director for the Pacific Northwest Regional Council of Carpenters. You're going to hear some of their comments in a few minutes. So I want to talk about our plan. And we have it up here on our screen here. It's our plan for getting back to work. So the requirements developed by this work group include work site safety plans that allow only low-risk work where physical distancing can be followed. If it can't be done with social distancing, then it cannot proceed at this time. The plan will require plans for controlling COVID outbreaks at job sites, should that occur. It'll have notice on what work will be performed on site, and obviously a general obligation to keep a safe and healthy work site under state and federal law. I actually think we need a different graph up at this point. We need this is the safety plan. Restarting low-risk construction. Other requirements of the plan include COVID-19 safety training for all employees, and importantly, employer-provided personal protection equipment. There is going to be a site supervisor responsible for this on each job site, whose job it is to make sure this plan is implemented. And I believe it would be valuable for upper management periodically to make themselves available at the job site so they actually see what their workers are experiencing on the job site, so that these people are actually protected. This plan also includes proper sanitation and cleanliness for workers, as well as policies to encourage workers to stay home or leave the work site if they have any adverse symptoms. And no job site may operate until the contractor can meet and maintain all of these requirements. Workplace safety and health complaints can be submitted to the Department of Labor and Industries, and obviously, eventually work sites could be shut down if there's not compliance with these orders. I think this is a very thorough and thoughtful approach, allowing construction to move forward. And I believe it is a very intelligent way to, on an incremental basis, return to our economy. We're going to continue to follow that plan that got us to that point today. I just want to comment on the way forward after this step. My office in the Department of Commerce will convene stakeholder groups to develop plans similar to what we've seen with the Construction Roundtable, to have procedures in place when it is the right time to start that process. And I want to thank all of those involved in our Construction Roundtable in helping us get to this very responsible plan to make sure that communities are protected as well as workers. So we know that our strategy is working, and we know that it is protecting people from sickness and death right now. And we do not want to have to go through this again. And people know this. The University of Southern California's Understanding America study found that 83% of Washingtonians agree that social distancing remains essential, and that 80% believe the outbreak will come back and worsen if we don't continue to practice social distancing. So I want to thanks again to the millions of Washingtonians all over the state who are abiding by the Stay Home, Stay Healthy initiative, who are helping save lives. Now I'd like to turn it over to a couple members of the working group who've been so effective in leading this effort. Mark Riker of the State Building and Construction Trades Council, representing hardworking people, and Greg Lane of the Building Industry Association of Washington. And then I'll stand for questions. I think Mark is going to go first. Mark.
Thank you, Mr. Governor. Greatly appreciate the opportunity that you have given us and the leadership you've shown in letting industry professionals provide guidance and assistance to you in your difficult decision-making process. Thank you for allowing and facilitating with staff, Caitlin Jekyll and Nick Schooley, who have been incredible in providing us the information we need to make good decisions and recommendations. I want to thank the rest of the roundtable, some groups that don't normally get along, and put aside our differences to focus on one thing: worker safety in Washington State. We never had any doubt about what our purpose was here, to give you the best advice possible in regarding to starting up construction as soon as we possibly could in a safe manner. There were no differences on that. Thank you for the time to put this together from industry professionals, and we look forward to continuing the work to the next phase. And I will say this, if I may, to the workers out there. The governor's given us the opportunity to have a great effect in our industry. He's put it back in our hands. It's our job to do it right. If we do it right, we'll move to the next step. If we do it wrong, we will be shutting ourselves back down through him. It won't be his fault, it'll be ours. So let's take responsibility and do this the right way. Thank you all.
Thanks, Mark. Greg?
Thank you, Governor. Good morning to everybody. You did a fantastic job of laying out the plan, Governor, so thank you for doing that. Speaking on behalf of BIW's 8,000 members, I can tell you that we in residential construction are very eager to get back to work. But we're also extremely committed to all of the requirements in this plan, because we know that that's what's necessary to keep our employees and their families and the public safe. So I really want to thank you, Governor, for putting this task force together. I want to thank you for the opportunity that I've had to serve on the task force, to have BIW be represented on it. This is, you know, as Mark alluded to, we come from very different organizations, but it really was clear from the first time we got together that we all agreed that safety was the highest priority, and it was our job to develop a plan that we knew would keep people safe on the job site. Once it was clear that we all shared that common goal of ensuring safety, it really didn't take us long to come up with what was necessary to protect our employees and the public. So, Governor, I'm really pleased that we can give you a list of safety requirements that I think you and the public can have confidence in, that we can get back to our job sites and prevent the spread of the disease. We at BIW know we all have to work together in this and to make it through this health emergency. And those of us in the construction industry, both commercial and residential, are committed to protecting our communities when we get back to the job site. We are excited to get back because we do have a housing shortfall in this state, a housing crisis in supply that we're eager to get back to addressing. There are about 200,000 units short in the state of Washington and meeting the needs of housing in our state's population. And the shortfall contributes greatly to more and more working families that are being priced out of the opportunity for home ownership. So we as home builders are excited. We're really pleased to get back to work. We're going to safely start addressing that housing shortfall again, and I hope to make housing more affordable for everyone in Washington. So thank you very much.
Thank you, and thanks everyone. I know you've been working on this for going on 3 weeks now, so thanks for your efforts. With that, happy to stand for questions.
First question comes from Rachel with AP. Hi, Governor, or maybe one of the other speakers can speak to this. I'm wondering how many projects around the state are now going to be able to resume, and how many workers are going to be able to go back to work because of this? And then will those projects be up and running next week? Will it take longer for the plans to come in? And then, Governor, second question for you. On the call today with Vice President Pence, he named Missouri, Pennsylvania, Oregon, and Idaho as among 16 states that have submitted plans to the White House. Based on the construction decision today, has Washington submitted a plan to the White House? And any other main takeaways you can talk about from that call?
Go ahead. Why don't Mark and Greg answer your first question?
So this is Mark here. We didn't address it in a manner of project by project. We addressed the challenge in a manner of tasks that can be performed in a safe manner on any specific project, so that its potential, most of the projects could start back up with certain tasks being performed on each of the projects. That way we didn't delineate between residential, commercial, industrial, heavy highway, but we're allowing things to progress forward, provided they can be done under these guidelines in a safe manner. So how many workers can go back? It's really hard to quantify. The public agencies, the owners, the developers will be assessing that. They have been, they've seen early versions of this document. So they'll be assessing that as soon as the governor allows them to and figuring out which projects we can get going safely. But we're in lockstep, labor and business, safety is the only thing we care about at the moment.
Yeah, and I'll echo those comments, Rachel. That's what I really think is the strength of this plan, is it's not focused on projects. It's focused on the work that's being done and the risk associated to the workers that are doing that work. It's really focused on the safety of workers. And so, you know, the tasks that are authorized under phase one require 6-foot distancing. They require PPE to be worn whenever they're on the job site to provide maximum protection for those employees. And our focus from the beginning was to develop a plan that was focused on safety, and we quickly got away from talking about project by project and delineating that way and focusing just on the work itself. And I think that's a real strength of this approach.
Yeah, Rachel, I was actually not on the call this morning because I was talking to companies that we're trying to get more test kits from, which is a continuing challenge for us. And we'll be able to give the White House some more acute planning when we get to a better position to know what kind of test kits we have. And that's why we've been urging the federal government to help us as much as possible to actually manufacture the test kits. And as you know, I think the Congress is going to do some good things to help us financially with that, which we appreciate. But the problem really is less financial and more physical right now, that these test kits simply don't exist. And that's why I was working this morning to try to talk to manufacturers to see if we could increase the manufacture of these test kits to get this job done. As we get more information about that, we'll be happy to share it with the White House. And I'm looking forward to doing that.
Next question comes from Joe with the Seattle Times.
Two-part question, Governor. Just to be clear, if contractors have this plan right now and are ready to go, does this mean they get to start back up today? That's number one. And number two, has the governor's office given any thought to some washed-out work, perhaps like the JBLM I-5 widening, that might be able to resume under, you know, some sort of safety rules like Boeing has right now?
Yes. As soon as I sign this order, that'll be today, that people can resume this work, again, safely. That applies also to state construction work. And so we'll charge DOT to be making sure they look at what functions could be possible, and I'm sure they'll be up to that task.
Next question comes from Jim Drew of the News Tribune.
Governor, I was wondering if you could explain kind of just the different phases that in terms of construction, how that will be introduced. Is this a low-risk phase?
Yes. This is the low-risk phase. This are the things that can be done with low risk, meaning that the tasks, the functions that can be done with a high degree of confidence that you can maintain that 6 feet distance separation. And if you can't, then you just can't do that function. Now, you know, that's going to delay some construction projects. We understand that. But we need to start on a low-risk basis, and that's what we're doing on this. Now, in addition to the distancing, we have plenty of protection to keep equipment clean, to give people gloves that they can wear so that when they're using common equipment, they don't get infected through surface contamination. So it's not just the distancing that's going to be necessary here. The appropriate facial covering, those are requirements as well. So this is not just one thing, it's many things to wrap workers in safety.
Next question comes from Hannah with Fire Radio.
Governor, just a question. One, you had mentioned earlier in the week that you were concerned possibly lifting some restrictions on outdoor activities and perhaps allowing some medical procedures after seeing some modeling. Wondering if that's happened and if you've made a decision on those things. Also, there are several businesses in the state, small and large, who think they will be able to have a safety plan and be able to open? What would you say to them right now?
The first question is, those things are still under considerations. We've not made final decisions on it. We do hope that we can start some elective surgery, but we want to do it in places where we make sure we have enough personal protection equipment for nursing staff and physicians and the like. So those things are under consideration, as well as some outdoor recreation. We'll have more to say about that in the next few days. Your second question was a little garbled. Could you try it again, please?
Sorry about that. Large and small businesses in the state would like their own chance to have a safety plan, something like you have here with the construction, perhaps that's all it does. They think they're capable of doing that and opening up. What would you say to them about why that's not going to need to happen?
Well, what I would say is we know what works, and what works is a very rational plan based on data, and the data is clear right now. If we had a wholesale reduction of social distancing, if we immediately treated this like a light switch rather than a dial, we would have an enormous increase in infection and eventual fatalities in our state. That evidence is clear. It is almost unanimous amongst the modelers. I was again briefed by the Institute for Disease Modeling yesterday on this subject, and it is clear that were we going to do that, if we abandoned our efforts, if we ran up the white flag of surrender to this virus, that virus would just came storming back, and that just is not acceptable. So for the other folks that are chomping at the bit to get back to work, and I know we all are, what we're doing and what I hope to replicate is what we've done in the construction industry. While we're waiting for that time where we can turn that dial, to prepare for that, to build the protocols that are necessary to go back safely when we can. But we're going to make that decision based on data, and we've got all kinds of data from infection rates to hospitalization rates to percentage to positives, and we'll share that probably, in fact, we'll have one day when we talk about that tomorrow in depth.
Next we go to Glenn Farley with King 5.
So, Governor, tell me a little bit here about, did you run an economic calculation here, basically in stages? Because obviously the state's losing money, everybody who works in construction is losing money. How much of an economic shot is this going to give us?
Well, we thought of this more from a health standpoint, at the same time realizing the economic ramifications of everything we do. When I've made some decisions, and frankly, there's been a lot of hard ones, I'm always aware of the economic ramifications on people, because they're profound. But we look at the health data to help guide those decisions. So when we issued the Stay Home, Stay Healthy initiative, we were one of the first states hit by this, and when we started this, we thought we were going to get hit the hardest. So we took a little bit more aggressive position than other states. We're the state that included a construction restriction while other states did not, and there's a reason for that. We knew we were first hit, and we knew we had to have some time to develop protocols for this industry before they would really safely be able to return. And we wanted to see if we could bend the curve. We now have bent the curve. We've seen that. We've learned from this. And this is going to be an intelligent, incremental process, and then we need to implement it. So we've learned some things in the last 3 weeks. We've now learned we think we can return to the industry safely, and obviously this is going to be a benefit not only to the workers, but to people who need housing. And I know you've heard the stories of people who were waiting for their house to be completed so that they could move in. Sometimes they had problems because they'd already sold their home. So this is going to help some of those individuals as well. And I hope it can serve as a template. But again, I just can't repeat enough that if we push that green button too soon, a lot more people are going to die. And we're pushing this one just when we can to be safe.
Next question comes from Keith with Como.
Governor, you were talking about people chomping at the bit. Construction, hospitals, outdoor recreation. Who up in the queue? People are waiting to hear what other parts of the economy are going to be reopened.
Well, as I've indicated yesterday and today, we're hopeful that we can have more what you might call elective surgeries going on. We're looking for a way to set the dial to make sure that we have appropriate personal protection devices available for the nurses and the doctors and the people who work in the hospitals to be able to do that. So we're looking at that issue. Admiral Rocky Bono, as you know, has been tremendous working with the healthcare providers to figure out how to set that dial. So we hope we can do that in the near future. We're working on that. Outdoor recreation, we're looking at how we can return to some of those activities, and as I said, we'll have more to say about that in the next few days.
Time for a few more questions. Next we go to Ashley with the Chinook Observer.
Hi, Governor. So when you're talking about opening up elective surgeries again, our hospitals out here in Pacific County right now are discussing trying to push through to be able to use cloth masks. We don't have enough N95s.
Right.
But at the same time, they're just bleeding money.
Mm-hmm.
So as you're balancing opening up certain elective surgeries for certain hospitals, how are you going to be kind of trying to balance who's getting what resources and trying to help out the rural areas in that way? And then in addition to that, overall the county is hurting from a loss of tourism, which is slightly our push right now, but we aren't large enough to have money distributed to us directly through the CARES Act. Do you imagine that if you do end up calling a special session, that the state might be able to direct money directly to our county or city government from the money that you guys receive from the CARES Act?
So there is that, yes, there is that possibility, and as you know, Congress today or yesterday is now working on some direct distribution to hospitals to plug some of their financial holes that have been pronounced because of the losing the elected surgery revenue. So we hope that'll be helpful to hospitals like yours. But this is not just a financial challenge. Your hospital just is the metaphor for while these decisions are really, really hard. We want to allow people to, who are in pain right now to be able to get surgery, but we also want to make sure that our nurses have PPE. And you have just hit the nail on the head why this is a difficult decision. The best thing we can do is to increase stocks of PPE. And I think you have known how aggressive I have been and our state has been in increasing those stocks. Now we do have 85 million pieces of PPE that are in the queue or in the supply chain coming to the state of Washington. As you also know, I have been very robust in urging the President to get off the dime and start producing some PPE with the Defense Production Act. And unfortunately, he waited weeks before he did that, and so we've been delayed. We have not had supplies that we would have liked. And Republican and Democrat governors share that view and have for some period of time. Now the federal government is starting to do a little more work to produce more PPE, and we're grateful for that. But we need to continue to ramp up the manufacturing. I also want to thank the local business people who are helping. Dan Nordstrom at the Outdoor Research is now making, or will shortly be making, I think, over 100,000 masks a week. We have a number of other businesses that have stepped into the breach to make issues. We have our prison industries making surgical gowns. We found some folks to do 3D printing, I think, for visors. So we're doing all we can to increase PPE, and that's ultimately the real solution to this problem. So we hope all of these things work. We're pushing as hard as we can. And please thank your nurses and your hospital staff and your respiratory therapists. The work they're doing is heroic, and we're thinking about them every day.
Next question we go to Simone with U13.
Governor, 2 questions for you today. As you're working with these industries to open back up in a safe way, if the outbreak starts to go back up related to these sites or not, is there a chance you could retract these decisions? And number 2, the state has some proposed emergency rules for temporary agriculture workers and housing. The agricultural department in our state coming out today saying they prevent half of the state's seasonal workers from being able to harvest crops, leaving half of our apples and raspberries out of being able to be harvested when thinking about a time of food insecurity at this moment on the proposed changes.
Well, obviously this is a challenge, it's a real challenge for our state because we need both safety for people who work in the fields and a steady production of food. And we need to find a way to reconcile those two. We need to find creative solutions to be able to provide safety to these workers. And as we have in the construction industry, we're working to try to talk to people who do the work and those who are orchardists and the like. I had discussions last week with 2 orchard companies in Yakima and a variety of representatives of the laborers to find out what creative solutions we can have to increase the safety to these workers. But this is a challenge because we have to do it in a matter of weeks, not years. So what I can tell you is we are trying to find the right balance of that safety and productivity. I do think there's a number of things we can do, and I hope we're going to be as successful in that industry as we have in construction. It's very important to all of us. Now, your question about what happens in the future, of course, that's unknowable, but we do know this. There is a possibility that waves could start again of this virus, and we will have to be alert. And the way I look at this is we need to monitor and adapt. We need to monitor the impact of our strategies, and we need to adapt, either plus or minus, depending on what we're learning. And if you listen to Bill Gates the other day talk about this, he recognizes, and the vast number of epidemiologists around the world recognize, that this is probably going to be with us for some period of time, and that we are not going to return to just a normal. We're going to have multiple things we will be doing differently in a variety of different ways. And that will be an iterative process. We will learn, we will adapt, we will get better, and we're going to try to keep driving this virus down. But yes, we've got to be alert to that as a possibility, and we have to be willing to change as the data and the virus load changes. And so far, Washington State has done that very well. As I've indicated, we have done some really smart things, and we've had a lot of diligence. We've had enormous compliance with this. I've been so pleased that Washingtonians are complying with stay home, stay healthy across the state of Washington. It's really it was pretty amazing. I was on a call last night with some business leaders from around the country, and this one a woman said, you know, when you think about this, this is one of the most unique, unifying moments in the national history. You know, when you see these numbers, 70, 80% of Americans want to continue fighting this virus, even though it's very difficult for us with this social distancing. I'm trying to think of anything where 80% of us have been so unified around something. And certainly that's the same case in Washington, as both our own observations and this polling data shows. So we are unified on this, we are effective on this, and we are committed on this. And so I think it's a great day to be Washingtonian.
Any final words?
No, I want to thank you again, and wash your hands. Thank you. Thank you. Wash your hands.